Welcome to this Academics in Nutshell series. I am Dr. Jaydeep Choudhury and today I will be discussing non-resolving pneumonia. Pneumonia can have many complications like Ehrlich syndrome, pleural effusion, empyema, pneumatocyst, persistent pulmonary hypertension, lung abscess, necrotizing pneumonia, and of course some systemic complications. Persistent pneumonia or non-resolving pneumonia is one such complication. Now, by definition, a non-resolving pneumonia is failure of clinical improvement at the end of 1 week of appropriate antibiotic treatment, or failure of radiological improvement beyond the expected time of resolution, and that varies from different organisms. Like Mycoplasma, it's about 2 weeks to 2 months. For pneumococcus, 1 to 3 months. For gram-negative enteric, it may be 3 to 5 months. And some viruses may take up to a year for radiological resolution. When we encounter a child with non-resolving pneumonia, of course, history and physical examination is the mainstay. And if we do a chest X-ray, there may be a unilobar or multilobar involvement. Now, if it's a unilobar, then either it's intraluminal, where bronchoscopy is the investigation of choice. When it's extraluminal or with structural abnormality, then either CT scan or aortogram, as the condition demands, is the investigation of choice. When there is multilobar involvement, there may be aspiration or there may be wheeze. For aspiration, again, barium swallow, bronchoscopy and bronchoalveolar lavage are the investigation of choice. And if the child presents with wheeze, then CT chest, bronchogram, immunoglobulin level, sweat chloride to rule out cystic fibrosis, bronchoalveolar lavage, or ultimately lung biopsy may be required. To remember, in a mnemonic, the complications of pneumonia presenting with non-resolving conditions, a mnemonic bad omen may be useful. B stands for influenza B and bronchiectasis, A for influenza A, abscess aspiration, D, drug resistant or delayed, that is steroid if it's given, or O for opportunistic like fungi, anaerobes, HIV, M for misdiagnosis or non-infectious. Here comes the pneumonia mimics a bit. E for embolism, empyema, eosinophilic pneumonia, and N for nosocomial and neoplasm. So to summarize, non-resolving pneumonia is essentially a clinician, host and organism interaction. When it comes to the organism, we have to think of whether it's a resistant organism or whether it's a polymicrobial etiology. When it comes to the host, there may be impaired host defense, underlying complications, congenital anomalies, inadequate clearance of mucosal secretions, and from the clinician point of view, it may be inappropriate therapy like selection of antibiotics, shorter duration of antibiotics, and definitely we have to think of non-infectious causes. Apart from this, pneumonia mimics is a condition that we have to keep in mind. Thank you. See you again in this series.